Hi, I'm Rachel Holmes, and welcome to the Health and Wellness Show. Thank you so much for all the feedback that I'm getting over all of my social media channels. I'm so glad that you're finding these interviews really helpful and inspiring and helping you become an informed consumer and really cutting to the chase and getting to the root cause of so many health issues and complaints. It's phenomenal. So if any of these interviews are particularly pertinent to you, please feel free to share them on your social media platforms, because the information that these contain can really change people's lives. So feel free to subscribe and please circulate by all means. Now, today I'm talking to a very interesting lady called Sandra. She is the founder and CEO of the Functional Medicine Coaching Academy. Now, she's going to talk all about exactly what functional medicine is, where it fits in the grand scheme of healthcare, and how a functional medicine practitioner and health coach could be helping you with any health problems or niggles that you might be experiencing.
Hi, Sandra. Thank you so much for taking the time to be with us today. How are you?
I'm great, and it is a pleasure and an honor to be with you today.
Oh, thank you so much. Firstly, the biggest question I always love to ask any of my special guests is, how on earth did you arrive at where you are today? What's the backstory and your experience and expertise, and how have you got here?
Well, it's a long backstory for me how I got here.
Yeah.
We're going way, way back into the 1970s when I got a master's degree in learning disabilities. And I taught special education for many years. I trained many special education teachers at a local university. And I always thought that there was something wrong with me because I always looked at what was right with the child as opposed to the diagnosis and what was not working and what was wrong. And I then entered a doctoral program in clinical psychology where I had the same issue. Everybody was talking about this raging borderline and this person who was depressed. And I thought, what's wrong? I just am not good as a diagnostician. I see what's right with them. Well, that was many years before a field came into being called positive psychology, which looks at what's right with you. And so I have always specialized in focusing on the positive, and my early training was in mind body medicine and biofeedback. So rather than traditional psychotherapy during my many years as a clinical psychologist, I would focus on breathing, on relaxation, on imagery, on the power of the mind. I specialized in working with people who had physical conditions, pain, chronic migraines, for example, and I used biofeedback relaxation techniques. So I found functional medicine and began to train in functional medicine and wanted to then pull everything that I had learned, all of my specialties from the past, and created a program together with the Institute for Functional Medicine. They train primarily practitioners, physicians, and I saw the value in training health coaches along the way. I had gotten some training as a health coach, and so I developed a 12-month online program that trains health coaches, and the curriculum is all of those areas that I had specialized in. So I blend positive psychology principles with mind body medicine, with positive psychology, with functional nutrition.
Wow, that's amazing. What amazing amounts of experience that you're putting on there. And you must have been so ahead of your time at that time. Must have been very few people moving forward in that field. That's phenomenal.
I was so ahead of my time. I was kicked out of doctors' offices. I remember one saying, "Shame on you for telling me that I should refer patients to you for biofeedback and relaxation. How is that going to help my?" He was a cardiologist. "How am I going to? That'll help people with heart conditions." Well, now the research shows that it definitely can.
I love that. That's what an amazing story. So pioneering. So did you start seeing patients who were coming to you? What kind of demographic were you seeing hands on at that time? How did you apply all this knowledge?
Yeah, I was seeing people from age 3 to 93. I was teaching them relaxation and I was pairing that with ways to change your thoughts and how you describe your experiences. I specialized in anxiety because I used to get panic attacks. So that's another part of my story. I really came to mind body medicine because when I was in my 20s, I had panic and anxiety attacks. So I wrote a couple books about panic attacks and how you can just stop them dead in their tracks by using breathing, slow, deep diaphragmatic breathing combined with imagery and using your imagination, imagining yourself as calm and relaxed, and the power of that, the power of changing your thinking instead of I must, I have to, or in the case of a panic attack, this is awful, I'm dying, I'm going to pass out here, to do what we call scientific thinking, rational thinking. And when you put all those techniques together, it's very powerful. So I was never a proponent of one theory, one ideology, and this is the way. But it's like a carpenter has a toolkit, and you have lots of different tools. And that's whether you're a coach or a psychologist or a physician, it's personalized. So you don't look at this theory and try and apply it to everybody, or this technique and everybody has to fit that picture, but more personalized. Who is this person who is with you, and what do they want? What's going to work for them specifically?
Yeah. So you put that all together and formulated a curriculum and a program. Um, does somebody that is accessing that program or that education, do they have to have a formal education? Do they have to be educated to degree level, to masters, or what sort of person is great at delivering this kind of information to people?
That is a great question. And the person who is great is someone who is loving, is ha, is hopeful, it can be with another person and experience empathy. And the research shows that you do not need to have any kind of background in healthcare whatsoever to be a good health coach. We have many people who enter our program with no training whatsoever. They are passionate about working with people and helping. They often had a health crisis themselves, and they found a way to heal themselves, often by finding a functional medicine doctor, and now they want to give back. In fact, some people who are the so-called experts, who have the highest degrees, the highest accolades, are not good coaches because they're experts and they want to tell somebody what to do. They don't want to sit and help them by asking the right questions and just listening.
Love that. I absolutely love that. I mean, going back to basics, functional medicine in the UK is probably, some people watching the video was not quite sure what it is, and not sure where it fits in. So kind of, if you want to go back to basics, Sandra, just tell us, what is functional medicine and what is a functional practitioner, and how does it all fit together in the scheme of healthcare?
Absolutely. Functional medicine is about digging deep and finding those root causes for chronic illness.
Mm.
So, a conventional medical approach would be you have a lot of specialists, and many people they go to a cardiologist for their heart condition. They might have a dermatologist if they have a skin issue. They have a rheumatologist if they have joint issues and autoimmune concerns. So each of those doctors are in their own silos. And if you have a rash, they'll treat your rash. They don't think, well, how is that rash connected to something else? If you have depression and you might see a psychiatrist, the psychiatrist might give you medication. They're thinking only about that depression. How am I going to get rid of it? How am I going to treat that depression? A functional medicine doctor looks at all of those symptoms and says, why?
Mm.
It's why are these happening? And maybe that person has depression and they have some cardiac issues and some joint pain. Maybe it's because there's inflammation going on in the body. And then they say, why does this person have inflammation? Well, let's look at their life. Let's look at what they're eating. Maybe they're eating gluten. They're eating gluten and a lot of dairy. Maybe they are sitting on the couch all day long and they don't exercise. Maybe they don't get enough sleep. Maybe they have a lot of stress in their lives. So we look at diet and lifestyle factors as those main drivers of inflammation, for example. And that's what's causing all of those conditions to appear. And then they will look at how do we address this through starting with diet and lifestyle change first, and then going up to it's not that functional medicine doctors are against medication, but they look at often many people get better with diet and lifestyle alone, and that's where a functional medicine coach comes in, because the coach is the person who can follow up from the doctor to help that person make those often difficult diet and lifestyle changes.
I see. And what is the movement like now in the US with obviously we're just on the edge of a very political shakedown as we talk to you today. So who knows where the US is kind of heading with healthcare, but with the functional medicine side of it, how is that? Are more people recognizing that approach? Is mainstream, the medical mainstream, are they accepting of this, or how is it all fitting together?
Functional medicine in the United States is exploding. The Institute for Medicine's conferences are selling out. In fact, there's one coming up actually in London in April that is sold out. There will be more because doctors are frustrated by the medical system. They are just not equipped to deal with the kinds of chronic conditions that we are faced with. If somebody breaks their leg, then they go to the emergency room, and the best of conventional medicine will be applied, and that's where they need to be. Similarly, we have very advanced ERs for emergency rooms for cardiac. If you're having a heart attack, you go to the hospital and you will get the best treatment for while you are experiencing that heart attack. However, the conditions, these chronic conditions like diabetes and all of the neurodegenerative conditions that we're seeing exploding, these are conditions that are really best cared for by someone who takes an approach where they are looking for the root causes. So that's what functional medicine comes in, and we're seeing a huge demand. And mainstream medicine is taking notice. The Cleveland Clinic in Cleveland, which is one of the most renowned centers, the most distinguished medical institutions, they opened a Center for Functional Medicine. Dr. Mark Hyman is director, and they are opening this huge new complex of new building, and they have about 2,600 people right now on the waiting list. So they are rapidly expanding their services. And other medical centers around the country are looking at Cleveland Clinic, and they're saying, we want a functional medicine clinic as well.
This is fantastic. And now that's interesting that you've said there's a functional medicine conference in London. So is London seen as the next explosion? Are people really getting, and doctors in the UK, are they getting on board with this now?
Yes, so I attend the functional medicine conferences, and we will talk to people in the UK. They're very excited. And we also, from our coaching academy, we have students who are applying. In fact, I just talked to, there was somebody I saw apply the other day who is from the UK. And so we have, of course, facilitators who are here, and we have many students we're told who would be interested in taking what we teach and developing this in the UK.
Yeah, because there's always been, I have a health and wellness franchise here in the UK, and all our health coaches and instructors, leaders are always trying to make links with the medical profession, and it's very difficult. The doctors in the UK work very long hours. They only have 5 minutes to see a patient per person. So, patients demand treatment in 5 minutes, so it's very difficult I imagine GPs are very frustrated because they just don't have the time. They would never have the time to go through somebody's lifestyle, stress, sleep, hormonal health, gut health, mental health, when they've just got 5 minutes to write a prescription. And so it is very difficult to get those links. But hopefully with conferences like the functional medicine, then our GPs will start to listen and realize that we do all really kind of need to work together if we're going to move forward.
Absolutely. And there's some good research coming out now that shows the effects of having a health coach that you work with, because it is less, patients get better faster, they sustain those changes over time.
Yeah.
It is also good for the doctor because that person that you described is probably pretty stressed. And so having a health coach with them can help their stress level. There's a new model that is a group medical visit that is catching on. So rather than in that limited 4 minutes you have with a patient, let's say they're a diabetic, well, you can have a group that meets, maybe they're meeting after hours in your waiting room, and you can have your health coach lead that group for them so that you don't have to give the same talk over and over again.
Yeah.
And people love it because they're a community, and now they're sharing recipes and they're out walking together and they're getting healthy together, and that is a huge impact.
Wow, so just something so simple as that can be implemented. That's fantastic.
Yes.
So if people are interested and they want to find out more about your organisation, where can they find you? Where can they sign up? When's the next program running? And how can they find out perhaps about conferences around the world that they may want to attend?
They can go to our website, which is functionalmedicinecoaching.org, and they can look at our program, and if they choose to apply, they can contact our admissions coordinator. And our next class begins in February of 2017. It's all online, and everything that we do is recorded. We have a lot of webinars. We have small groups meet together, and we are mindful that people come from different time zones, and so that's why everything is recorded. And we are going to have, as we grow in the UK, we will have more course facilitators. So for every 25 students, we pair them with a course facilitator who will support them while they go through the program. And then the conferences, if someone is listening who is interested in the Institute for Functional Medicine, they would go to functionalmedicine.org. It's the same, it just doesn't have the coaching at the end. So they would learn about programs that are offered through IFM. And that organization is for practitioners.
Okay. Oh, so is there anything that can sort of health coaches can go to, or can health coaches go to the practitioner events?
That would be to our organization. And we are going to be expanding and having in the future more live conferences. And many of the students who are coming to our program are already health coaches. Some are newbies, they're changing careers. We have a lot of people from business background, but we also have health coaches who want to learn functional medicine. And that's what we would provide them, as well as helping them to hone their skills. And also with this new model, we teach them virtual coaching. We teach them how to coach groups. And so somebody might be in another area of the world, and doesn't matter that you're in the UK, because you can get on a call like we are now through Zoom, and you can have a clientele that is all over the world.
That's fantastic. Amazing. The opportunities now are just limitless, aren't they? They really are. Gosh, that's
absolutely.
If anybody wants to ask you questions, Sandra, where can they find you on social media? Is there a particular Facebook group or page that you're active on?
Yeah, so it's the same thing. It's Functional Medicine Coaching Academy, and we have a Facebook page. I hope you'll come and visit our page. And then if you go to our website and you want to speak with me directly, I'm happy to speak with anyone in your audience as well.
Oh, that's wonderful. Thank you very much. It was lovely. Thank you for taking the time to speak to us today. And I know we'll have a lot of interested people about this conversation. So thank you.
Thank you so much. It was a pleasure and an honor to be here. Bye.